In North America, President Joe Biden tested positive for COVID-19, where he was in Las Vegas for a series of events, the White House said in a statement, with White House Press Secretary Karine Jean-Pierre saying Biden tested positive following his first event in Las Vegas. Biden's doctor, Dr. Kevin O'Connor, said in a statement released by the White House that he was tested after he experienced upper respiratory symptoms. His doctor said he has already taken his first dose of Paxlovid, a medication that is associated with reducing the chance of hospitalization or death. Jean-Pierre said he is returning to Delaware, where he will self-isolate and will continue to carry out all his duties fully during that time. Biden has already scheduled to head to Delaware after his visit to Las Vegas. Biden, who had been expected to speak at the group's event in Las Vegas, was about an hour and a half late before the announcement was made. We now head to Europe, where a UK public inquiry has found that the government's processes, planning and policy failed the country's citizens in lead up to the COVID-19 pandemic. The inquiry's report states that the UK was unprepared for the pandemic, which resulted in over 235,000 deaths. It identifies several significant flaws, including preparing for the wrong type of pandemic. The report calls for radical reform, including a major overhaul of how the government prepares for civil emergencies. The inquiry's chair, Baroness Heather Hallett, says that the country's emergency systems failed and that this cannot be allowed to happen again. The report makes 10 recommendations, including the creation of a single independent body responsible for pandemic preparedness and response. Prime Minister Sir Keir Starmer has committed to learning from the inquiry's findings and putting better measures in place to protect the country from future pandemics. To further discuss this, I'm being joined by Thamsanqua Zhou, journalist and global affairs analyst. Thank you so much for joining us on the news.
Thank you for having me, Lepa.
So, Tham, please, can you tell us some of the main outcomes of the COVID inquiry?
Well, first of all, it was quite extensive. There were so many witnesses that we saw go into the inquiry. I think it's important to talk about process before talking about the outcomes, because that outcome you have just told the viewers in the intro is a product of a very detailed process that included former Prime Minister Boris Johnson, who was Prime Minister at the time. Rishi Sunak was Prime Minister later. There are so many people, the former ministers were responsible for health, all the people that handled COVID at that time, as well as representatives of families and those that were lost. So some of the outcomes are really detailing the fact that the United Kingdom was ill-prepared for the type of pandemic that it was. There were many findings in terms of how hospitals were not ready, the PPE or the equipment that people needed to use was not ready. The government itself, it is said that it wasn't prepared, and there were no lessons, most importantly, no lessons that appeared to have been learned from Asia and even other countries in Latin America that had handled pandemics of a respiratory nature in the past. Leko?
All right. So what has been the reaction now from relatives of those who actually lost their lives during the pandemic, as well as from the main political parties on the outcomes from the inquiry? What has been their response to this?
I think, first of all, we need to acknowledge that there's been a change of government. But during the course of the COVID, both the Labour Party, who were the opposition at the time, and the Conservatives, who were the government, worked together. There wasn't much opposition in terms of how the COVID was handled. The two main parties appeared to have been working together. What we have heard from the relatives or representatives or the voices of those that are representing the relatives of those that were lost especially Professor now Fodong, who's been speaking on behalf of the bereaved families. They've said that they take note of the findings. They agree in basic terms with what has been found, but then they also outline that there are other areas where the report could have gone, in particular, the role that was played by inequalities in society, because when you look at the statistics, there were communities that appeared to have been more vulnerable to the pandemic than others, especially ethnic minorities, people who were kind of in frontline jobs, and those that were in nursing homes in particular during the course of the beginning of the pandemic, before a lot of people understood how to reduce infections. And they have spoken, I think, in particular about the fact that the government appeared to have been dealing with the consequences of the pandemic rather than the what was actually behind the pandemic and trying to reduce infections in particular. Lekon?
Okay, I now know that the Prime Minister, Sir Keir Starmer rather, is actually particularly interested in this and trying to ensure that this stops and they get it right, hoping fully that there won't be a pandemic some other time. So how will this new Labour government now try and improve the UK's preparedness for another pandemic? Hopefully there won't be none anyway.
There's continuity in government. It really doesn't matter who is in government. Whoever is there now, these recommendations, now that they've been made, they relate to the government that is there now. So Wes Streeting and Sir Keir Starmer, who is now the Prime Minister, they have to look at these findings. There are certain timelines that have been put in there, like reports that are needed, in terms of the recommendations, forming those committees that need to be looking at what is likely to be coming, and will the country be ready to handle or tackle those particular issues. So this now falls on Sir Keir Starmer and his government. There's no running away from it. But then also there are a lot of good people that are working in the industry. We have to acknowledge that, especially like some of the people who handled, who are both in the medical field and advising, and some of them learned this, like Chris Whitty. He learned, he stayed in Nigeria, he understood. So a lot of people say that background of being in other places and other countries, like Chris Whitty, having spent time in Nigeria, assist input into these committees that are now needed to look at how should the country respond to any pandemic in the event that one might be visiting us in future.
Okay, Thamsanqua Zhou, journalist and global affairs analyst, thank you so much for sharing your thoughts with us.